Endometriosis affects about 1 out of every 10 women here in the U.S., but the disease is often misdiagnosed or missed altogether.
And now new European guidelines could help doctors identify it earlier. News 9's Robin Marsh explains in today's Medical Minute.
Well, that time of the month can be inconvenient for a lot of women, but for Susie Veach, her periods were painful, and for 8 years, she didn't trust what her doctors were telling her.
They're just ovarian cysts. We can't really do anything.
Finally, Susie found a doctor who correctly diagnosed her with endometriosis. That's a condition that happens when tissue similar to the lining of a woman's uterus grows outside the uterus. Doctors typically use special laparoscopic instruments to look inside the patient and spot the disease, but cases that aren't classic endometriosis may be overlooked.
There are many, many other types of endometriosis, and they are not as obvious. So that is actually one of the things that we're trying to improve upon is detection rates.
Scientists in Europe have proposed new guidelines that could improve those detection rates. The new recommendations support imaging techniques like ultrasound and MRI for diagnosis, in some cases instead of only laparoscopy. Experts say diagnosing endometriosis without the need for a procedure like a laparoscopic surgery every time could lead to a quicker diagnosis and treatment, something patients like Susie would appreciate.
I think it's really important to ask the questions and get the diagnosis, and don't give up if 2 or 3 or 4 doctors tell you you can't do anything.
Experts say these European recommendations may be a blueprint for what could happen for women all over the world. In fact, doctors say for many women, a diagnosis of endometriosis could be 8 to 12 years down the road. For today's Medical Minute, I'm Robin Marsh.